Angelique Coetzee, Chairperson of SAMA, joins us now on the line to tell us more. Angelique, good evening and thank you for your time. Why do you think the MEC and particularly the province is being iron-fisted in the manner in which they are dealing with these two doctors?
No, this is a very difficult question. Good evening to everyone out there. We don't know. She hasn't answered us yet. She did release later this afternoon a public statement, but SAMA is not going to answer on that statement. We would like to have all the facts, and it's a factual thing. And what, according to what we know, is that the powers that's been now given to MECs or provincial departments of health or to other people except what always highlight at Parliament. In the past, Parliament was a decision-making body. Now, with this COVID-19 and lockdown, so certain of these powers has now been given to, as I've said, ministers or to the MECs and so on. So apparently, the thought in Limpopo is that people is not listening. They are sent for to self-isolate. And then they don't self-isolate, or they isolate themselves, and then, in fact, the rest of the family. I think, and that is the sort of rationale behind this madness that happened yesterday.
You seem to suggest, though, Angelique, in your letter that the MEC feels the two doctors brought the virus to the Limpopo province, and therefore they should be held in isolation at a health facility.
Okay, so let's go two steps back. First of all, these doctors didn't travel. The one doctor never traveled, and the other doctor traveled in the middle of last month to Joburg by car. So there was no other. If that is travel, then yes, that's travel. But there is no people that she met in Johannesburg that had any contact with COVID-19 patients, or that she got it from there because no one is ill there. So these two doctors work in this hospital, and the one doctor got a flu-like symptom and then asked whether she can be tested. They told her no. You need to have a travel history, especially international travel history. We will not test without that part of the history with. So, and your symptoms is most probably cold and flu related. So she wasn't that sick. She got this dry cough, but felt increasingly uncomfortable with this whole idea of the cough and knowing that they are treating patients. So went for self-testing. Self-referred her to a private clinic in Bella, tested, and then it became positive. So first of all, there's not a travel history as per the broad definition of travel. The second thing is these doctors immediately went into self-isolation. Yeah. The fact is they stay alone in a house, so there's no one else that they can infect.
So according to your letter, you're saying the doctors are in direct communication with the MEC, or at least the Limpopo Department of Health, because you're saying the doctors were informed by the department. Were they informed as to why the MEC or the department feel their self-isolation measures are inadequate?
Well, unfortunately, SAMA cannot answer that question. That is a question that the MEC in this case must answer. She must answer why she thought that these two doctors didn't self-quarantine and they pose a threat to anyone else. The only other people or bodies in that house is 2 or 3 dogs. That's all. There is no one else in that house. They didn't leave the house. These are responsible doctors. They didn't leave the house. They did the correct thing. When they were diagnosed, they phoned their employer, told the employer of the diagnosis, stayed at home, get the temperature as they were supposed to be, was called by the MEC on Monday, and there was a normal conversation. Tuesday, there was emergency healthcare workers sending out as per protocol, which is absolutely 100% correct. They attested the doctors, no temperature, nothing. Then on to Wednesday, the healthcare workers came back to the home for another inspection and then informed the two doctors that, listen, you now need to go into a facility. You cannot self-isolate anymore. The doctor said, look, but we are fine. There's no reason why we should go. And because I started to say, but we know our rights, we know what the protocols are, blah, blah, you know, they gave all the reasons. They were then seen as being obstructive and then was threatened with a court order. Subsequently to that, they also phoned again the MEC and said, please listen, this is what's happening, you know, and the MEC just told them, you brought it into my province.
Yeah.
And I think it was a rude conversation if you listen to the conversation, but it's not my place to badmouth anyone. That's not my place. And we need to be clear, and I've said this since this morning, this is not about the fact that it's two doctors. It's about the fact that there's a protocol. The protocol was followed by two individuals and then decided by a province that we don't like what you are doing and we're going to put you into a self-isolation center where you will be locked down. You know, if that is the way that we're going to treat our patients, that is following the rules, then it's a sad day.
All right, let's leave it there. Dr. Angelique Coetzee, Chairperson of SAMA, writing that strongly worded open letter to the MEC of